My name is Jordan Cohen. I'm a recent graduate of North Carolina State University. I recently got my master's in physiology from there. So I was actually working at a dental practice, Sparkling Smile. I was getting more shadowing hours, also helping the doctors with their patients, just the normal what you would do in the dental office. Also dealing with insurance with patients, also assisting, going to OR with my doctors to work on other patients who needed like extensive work done. And I also was applying for summer classes. So before COVID even hit, I was applying to do summer classes because I needed to take a course over. Nowhere did I think that we were going to get shut down for 3 months. Like 3 months, it was crazy. And my summer class started May 13th. So I was still trying to figure out in the midst of things like, do I still have a job? How am I financially gonna pay for this? Like, I've already paid for these classes. I can't get the money back, so I have to go through with it. So I was just thinking about all these different aspects that you wouldn't have thought about before because in normal life, you got to do what you wanted to do, apply for the different summer schools, how you wanted to do, take classes, everything under the sun. But then when COVID hit, the whole world stopped and completely changed. And I wasn't prepared for that at all. Now, the struggle came in is when I had to take one of the classes over. And it was just hard meeting with the teacher. With the office hours, it was only like once a week for 3 hours. That's all that the teachers could give us. And I understand because they also still had research to do. And sometimes the deadlines might have got extended, but they still had to go into campus and do the safety protocols, which were like masks, suits, and everything. So they had a lot on their plate also. So I understood that. It was just very like difficult trying to take a class online where the teacher was trying to do the best he could, but we needed more like not one on one, but more office hours. But it wasn't his fault because this is just what we were in. Like this is the time that we were in, and it was very like hard. It was very a hard time in my life because I was really just trying to do everything as a dental applicant that you want to make sure that you have completed before finally pushing that submit button. Because once you submit, it's like it's sent off. Like it is what it is. Like you really have to put everything into that dental application. So like when I took those classes, it was very hard, like hard because I couldn't get the regular teaching that I was used to. I was used to going to a classroom. I was used to be able to ask questions throughout the whole lecture. If you had questions after class, I could always go to the teacher after class and ask questions. Supplemental help, like any tutoring or anything like that at school, you could they would give you that. You didn't have any of those resources. Literally, everything was on you, and you had to really figure it out. Well, before COVID even came about, so I have been in school literally from 2012 to 2019. And 2019 is when I graduated my graduate program. So in between that, like literally this was my gap year. And that May I was supposed to apply what I am in a cycle of applying. But I never thought about pushing it off because I always had like a schedule. Like if I knew this year made me get more competitive for applications because I feel like when I graduated grad school, I did good in grad school, but I just felt like I didn't have that dental experience. Dental like putting me in the field, like letting me know how to deal with patients. What is your day to day gonna look like? What type of situations are you gonna have, emergency, or even think fast on your feet? Like I didn't have that because I was never in a dental office setting. I have done like programs and everything of that nature, but it's way different when you work a day-to-day basis with a doctor and see what they deal with on a day-to-day basis. And for me, I didn't want to push out my application no much longer. I wanted to like actually apply. So it was always the plan to apply this cycle. It just, with COVID thrown in there, it was just made it a little bit more hectic than it usually is. I definitely have, like, it's because I have talked to some of my colleagues who are in dental school who got in the last cycle and started this year. And I don't know, it's kind of affecting the dynamic, I feel like, of teaching the students of what they need to know because it's just, for instance, maybe growth anatomy. Not everybody can be in the lab working on cadavers. So you have to have specific times and specific days throughout the week so each student can have enough time with the cadaver. But how does that go with testing? Are y'all still testing everybody at one time, or y'all doing multiple testings throughout the week? It's something like I don't know how they're doing it, or I don't know how they're like getting through, because they have to really change their whole curriculum, because not everybody can sit 100, like bigger dental schools are like maybe 100 and something. You won't be able to sit in there like UCLA or USC or something like that when they have all those students in one classroom in the auditorium. You can't do that anymore. So it's like, it worries me because I feel like, yes, math are good, and yes, health professionals are health conscious, but people who are not in the health professional setting or in the discipline or career, they don't take it as serious as we do. Whereas we're like, no, we'll rather go online, we'll rather like save ourselves because nobody knows what the virus does. So my pre-medical advisor at my undergrad institution, A&T State University, Dr. White, she has this program where you can record yourself on a laptop, and you can type in the questions and there'll be somebody projecting it to you. So like, say, why are you motivated to go to such and such? And then you answer it, and you can see like what's going on with your body language. Are you making eye contact? Are you actually answering the question to its capacity like you're supposed to? Like, does your suit and tie look fine? Like, are you meeting all the benchmarks when it comes to interviewing someone? So it's like, I can go back, I can go slow it down, I can like see the comments like from other people. You can send it out through the pre-professional program which she has. So it has people who like have been in like medical dental optometry school, and basically they'll make comments of what you think, they give like their criticism or comments they feel like will make you a better applicant when you're answering it. So that's the program I've been using. I also been talking to my friends who are like business majors, and that's their thing, resumes and interviews. So like, they definitely been proctoring me. We've been on Zoom calls also. They're just trying to like get me up to par where I need to be. So my mom's been kind of concerned because she was just basically like, so how is school going to be? How are they going to protect you? Because she said, I mean, your job is protecting you with your PPE, with gowns, gloves, goggles, shields, all that. So how is the dental school going to protect y'all? And I was like, most likely, I said, a lot of the classes will be online. Of course, like growth and other stuff like dental anatomy, you're gonna have to do in the lab. So you're gonna have to make them like time and days. The school's gonna have to. But I said probably like the general, like maybe biochem, micro, and all that, like just the courses you go over your first year, you're gonna have to probably be online, which I'm okay with that because it's better than me catching something that possibly I cannot be. So, and I have underlying condition of asthma. So I know for a fact, like for me, even like sometimes going to work, it's kind of like a little bit overwhelming because I don't want to catch it because I know like it is a respiratory infection. So I'm not trying to, I'm not trying to get the virus at all. So my practice, they're like they are definitely keeping their employees safe. Like they have all the high tech stuff that we need as far as shields, goggles, gowns, gloves, changing, letting the room sit for 15 to 30 minutes. They're doing everything to make sure that their staff is okay. So some of the other precautions that we do a screening before you come in. So we do ask you COVID-19 questions. Basically, have you in the last 14 to 21 days, have you had a fever of any nature? Have you had any type of shortness of breath or hard to breathe? Have you had any loss of taste of smell? Have you had any upset stomach, fatigue? And then in the last 14 days, have you traveled from state to state or out of the country? Now, some other places, they don't do state to state, but we took the precaution to say if you have traveled outside of the state of North Carolina to another state, then you have to quarantine for 14 days. That's just for our practice. I don't know about what everybody else is doing, but that's what we did. So when I was an undergrad, I knew dental was what I wanted to do. That's like what I wanted to do. I really didn't have, I had a dentist back home and I had an orthodontist back home, but I never really had like a mentor or a dentist like to like let me know about events or stuff that I could get into to get more involved with the dental field. So when I got to A&T, I joined USNDA, which is Undergrad Student Dental Association. So from there, I did my first mom's clinic, Mercy Missions of Mercy, and it was like the most humbling experience. So the event starts at like 5 or 6 o'clock in the morning. So in North Carolina, like the dental healthcare, we're like 49th in the state in all states of dental care. Like that's not really good. So we have these events for people who are uninsured, and they stay out there like from 12 at midnight before the event to all the way to 5 in the morning. And mind you, the event that I went to was winter, so it was like November, October. So they had stayed out there all night just to get a toothache fixed or get teeth extracted or get an abscess, get some antibiotics to kill the infection underneath the bone, the gum line. Like it was just a lot. Also do fillings, do cleaning. So our first patient, his name was Miguel. Miguel was a cool person. Like he was really nice. Like he changed my aspect of like what dentistry is and what you're really doing. You're not only giving confidence to the person, but you're also getting them out of pain and helping them build their treatment back up to great dental health. Because let's just face it, everybody think. Now, a lot of people don't care about the teeth, but they care about medical and make sure. But dental is just as important as medical. I would say focus on you because your time is your time. Worrying about everybody else and what they got going on and not concerning yourself with what you got going on can make you go off a track. If you don't really like during the pandemic, yes, I would say the pandemic has changed everything else for all of us. But you also have to learn how to adapt real quick. That's even in dental school. So I would say adapt real quick or not conform, but adapt. Make sure you're doing what you need to do, and stay on the road because everybody has hard days. Doesn't have good days. Like it's just the way of life. But if this is your dream of yours, you will continue to keep riding on this road until you reach your goal. Nobody should ever quit their dream. Everybody should always go for it. Even though sometimes it gets hard, you might not have support here and there, but just remember you're your biggest fan. Like your biggest fan. You're the one who's gonna make sure that you get to where you need to go. Nobody else is gonna do that. So that's during my whole time in my journey, dental journey, and still during the journey to this day. I have to always remind myself, you're your biggest fan. You have to push yourself. You have to continue to do this because you put how many years into this, and you can't just walk away from it. You have to keep going and keep striving. So I would tell anybody, just stay on your track. And if it was easy to be a doctor, everybody would be a doctor.